This video is to demonstrate how to use the PT Press 2. The PT Press 2 is a device that allows a patient who's seated in a wheelchair to perform a leg press exercise as the therapist provides manual resistance. Meanwhile, the therapist can protect their back with good body mechanics. The PT Press can be placed against a wall or otherwise stable surface. If you place it against a door, make sure the door is locked and won't open during use of the PT Press. The press can be adjusted by raising and lowering all four legs, just like a walker. So the height of the press can be made higher or shorter depending on the wheelchair height and the patient leg length. Then you just place the PT Press against the wall or other stable surface. That's when you bring in the patient. And usually this is when I, especially the first time, demonstrate and instruct the patient on the leg press exercise we're about to do. After I've demonstrated and instructed the patient, I then have them place their feet on the footboard. If they need assistance with this, that's when you can help them. If you need to add some more traction, a piece of Dyson can be placed on the footboard also. The therapist then stands behind the wheelchair, and that's it for setup. You're ready to use the PT Press. To use the PT Press, have the patient bend their knees and then have them extend, and the therapist applies appropriate resistance. So Sam, go ahead and push back against me. Push, push, push. Good. Bend and push. Good. Bend and push. The therapist uses their arms, their chest, their legs, and their body weight to apply the resistance. Meanwhile, the therapist's back is in a nice, safe position. You can do concentric or eccentric exercises with this, and you can apply the appropriate amount of reps and sets and resistance for each patient to meet your endurance and strength goals. Some ways to add some variation to the exercise is to have the patient take one leg away. So Sam, put this leg on a leg rest. We'll kind of center up the press on their leg they are using. And then Sam, I'll have you bend your knee and give me a push. Good. And bend and give me a push. Good. This adds some intensity for the patient. And push. Another thing that we can add to make it a little bit harder is hand the patient a TheraBand. Have them have their elbows straight, and at the same time they're pushing, stretch and pull the band back. So we're incorporating upper and lower extremities plus some coordination. Okay, Sam, so let your knee bend. At the same time you push with your knee, I want you to pull with the band. Ready? Go. Good. That's a good rep. And push. Good. And push. And pull. Good. Okay, Sam, you can stop. Hand me the band. We're going to go ahead and put her foot back up on the board. So lift this leg up. We'll move this over a little bit. There we go. One of my favorite things to do with the PT Press to really make the patient work a lot harder is to have them lean forward slightly. And I cue the patient by saying, pretend there's an egg at your low back, and I'll put my fist about their low back. When you push with your legs, do not squash the egg, okay? This makes the patient engage their trunk muscles, plus it also isolates the legs and makes their legs work a lot harder. Okay, Sam, so when you push, don't squash that egg, and push. Good. And push. Don't squash that egg, lean forward. Good. And push. An added benefit to the PT Press is that it helps to reposition patients who have slid forward in their wheelchairs. With this, have the patient, or help the patient, put their feet up on the PT Press, and then you push them forward so their knees are bent. Then you lock the brakes. And at the same time the patient pushes backwards, the therapist can just shrug their shoulders, lifting the pad or the Hoyer pad underneath them to help them scoot themselves back. So Sam, I'm going to reach down here and grab the pad, okay? When I count to 3, I just want you to push back with your legs, okay? 1, 2, 3. Good. Much safer for the patient and the staff. Therapists should use the same precautions they use when working with patients with any situation, such as weight-bearing limitations, range of motion precautions, fused joints, wounds, or patients who cognitively cannot safely use the PT press. Thank you for watching this video. We hope it's helpful and helps your patients. If you have any questions, just visit our website at leexercise.com.